you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is a continuation of my first video about leprosy, and it is going to detail other 3 types of leprosy. If you watched my first video, you now know that I only detailed the 2 major types of leprosy. That is the lepromatous leprosy and the tuberculoid leprosy. So this video is also going to talk about the other 3 types of leprosy. That is the borderline tuberculoid leprosy, the borderline leprosy, and the borderline lepromatous leprosy. I felt the need to come back and explain other 3 types of leprosy, such that if you see any of the signs and symptoms that I'm going to detail, you can easily know if you or your loved ones has leprosy. I also want the health workers to know how the different types of leprosy present, such that if you see any of these signs and symptoms in your patients, you can easily diagnose them with leprosy, so that you don't miss out the diagnosis. From my first video about leprosy, you now know that the type of leprosy an individual will end up with is dependent on the competence of their immune system at the time they got the infection. For example, the individuals that had a good immunity at the time of infection will end up with either tuberculoid leprosy or the borderline tuberculoid leprosy. Those that had a poor immunity at the time of infection will end up with the borderline leprosy or the borderline lepromatous leprosy or the lepromatous leprosy. I also need to add that the borderline tuberculoid leprosy and the tuberculoid leprosy fall into the category of the paucibacillary leprosy, while the lepromatous leprosy, the borderline lepromatous leprosy, and the borderline leprosy fall into the category of the multibacillary leprosy. Paucibacillary simply means that the lesions of that individual has few Mycobacterium leprae. When a sample is taken and it is looked at under the microscope, there are few Mycobacterium leprae. This is because these individuals have a good immunity, and the immunity helps to eliminate some of the Mycobacterium leprae. That is why they have few Mycobacterium leprae. Multibacillary simply means there is a lot of the Mycobacterium leprae in the lesions of these patients. That is why the lepromatous leprosy, the borderline lepromatous leprosy, and the borderline leprosy fall into this category of the multibacillary leprosy. This is because these individuals have a poor immunity, and this immunity was unable to eliminate the Mycobacterium leprae. That is why when a sample is taken from these lesions of the patients, it has a lot of the Mycobacterium leprae because it wasn't eliminated. Now let's dive deep into the different types of leprosy. The first one is the tuberculoid leprosy. Tuberculoid leprosy is a mild form of leprosy. It usually occurs in individuals that have a good immunity. The disease is more localized, but it is associated with more deformities because there is early involvement of the nerves. The lesions usually contain few numbers of the Mycobacterium leprae, and this is because the individual had a good immunity, so majority of the Mycobacterium leprae were killed off. They were eliminated by the cells of the immune system, the macrophages. Therefore, the affected individuals cannot easily transmit the infection to other individuals. Tuberculoid leprosy usually presents with well-localized, well-demarcated skin patches. They are usually red in color, or they are hypopigmented. That is, they look paler or lighter than the skin surrounding them. These skin patches are usually 5 or less in number. There is also associated sensory loss. That is, when you touch that skin patch, you cannot feel that area. And this is usually the most dominating feature of the tuberculoid leprosy. that is the loss of sensation. Tuberculoid leprosy usually has a good prognosis, a good outcome, because usually the individual has a good immunity, so they can easily eliminate the infection, or they can easily prevent the infection from spreading to the rest of the body. The second one is the borderline tuberculoid leprosy. The borderline tuberculoid leprosy is a mild form of leprosy, and it occurs in individuals that have a good immunity. However, if an individual that has the borderline tuberculoid leprosy does not get treated, or they develop a low immunity for some reason, maybe they get HIV, they get diabetes mellitus, it can downgrade into these other forms of leprosy. For example, the borderline leprosy, the borderline lepromatous leprosy, and the lepromatous leprosy. The borderline tuberculoid leprosy presents with hypopigmented plaques or macules. Hypopigmentation simply means that the affected area has a lighter skin color in comparison to the skin surrounding it. A macule is simply a patch on the skin that has a different skin color in comparison to the skin surrounding it. But usually this skin patch is not elevated above the skin surrounding it. It is on the same level with the skin surrounding it. While a plaque is a skin patch, but it is usually elevated above the skin surrounding it, and it is usually more than 1 centimeter in diameter. And the top part, the surface of the plaque, is usually flat. The surfaces of the lesions of the borderline tuberculoid leprosy usually are bald, that is, they have no hair. The surfaces are also dry and scaly. They are covered with scales. The nerves within these lesions are usually thickened or tender. That is, when you touch them, pain will emanate from them. Sometimes the lesions of the borderline tuberculoid leprosy might have loss of sensation, but sometimes they might retain their sensation. The skin lesions are usually more than 5 but less than 10 in number. There are also associated satellite lesions. Satellite lesions are smaller lesions that appear near the larger primary lesion, and they usually indicate that there is spread of the infection to the surrounding skin. Satellite lesions are very important because they are the cardinal signs of the borderline tuberculoid leprosy. They differentiate the borderline tuberculoid leprosy from the tuberculoid leprosy. This is because they are absent in the tuberculoid leprosy. Remember that the tuberculoid leprosy also presents with the hypopigmented skin patches. However, it does not have the satellite lesions as in the context of the borderline tuberculoid leprosy. So what you have to know is the lesions of the borderline tuberculoid leprosy are similar to those of the tuberculoid leprosy. The only difference is the lesions of the borderline tuberculoid leprosy have accompanying satellite lesions. They have those small lesions that will appear near the bigger lesion, and the primary lesions are usually more than 5 in number but less than 10. The lesions of the borderline tuberculoid leprosy usually contain few of the Mycobacterium leprae, that is between 0 to 2. This is because it occurs in individuals that have a competent immunity. So the immune system tends to eliminate majority of the Mycobacterium leprae. That is why there are few in these lesions. The third type of leprosy is the lepromatous leprosy. Lepromatous leprosy is a severe form of leprosy, and it occurs in individuals that have a poor immunity. The affected individuals usually present with red or purple lumps or nodules under the skin. These nodules usually contain a lot of the Mycobacterium leprae, and this is because the affected individuals had a poor immunity and they could not eliminate them. Because the Mycobacterium leprae are many in number, the affected individuals of the lepromatous leprosy can easily transmit the infection to other individuals. On the face and the eyebrows, These nodules can join together to form bigger nodules, and this can result into a leonine fashion. There might also be loss of eyelashes and eyebrows. There can also be loss of sensation as a result of damage to the peripheral nerves. Blindness can also occur as a result of damage to the eyes. The affected individuals can also develop painless ulcers at the bottom of their feet. And this is usually because of damage to the nerves. There can also be paralysis or muscle weakness, especially for the muscles of the upper and the lower limbs. The fourth type of leprosy is the borderline leprosy. The borderline leprosy is a severe form of leprosy. It occurs in individuals that have a poor immunity. If treatment is not instituted, the borderline leprosy can progress to the borderline lepromatous leprosy or the lepromatous leprosy. Borderline leprosy presents with a dimorphic skin lesion. The dimorphic skin lesion is one that has both the features of the tuberculoid leprosy and the lepromatous leprosy. The skin lesions of the borderline leprosy present as multiple circular skin lesions with poorly demarcated outer borders. They also have sharply defined, punched out centers. There can also be enlargement or inflammation, that is irritation of the nerves, and this can either affect one side of the body or both sides of the body. The lesions of the borderline leprosy usually contain more bacteria compared to the borderline tuberculoid leprosy lesions, and they are usually about 3 to 4. This is because the borderline leprosy occurs in individuals that have a poor immunity and the immune system was unable to eliminate these bacteria. That is why they are more in number. The fifth type of leprosy is the borderline lepromatous leprosy. The borderline lepromatous leprosy is a severe form of leprosy and it occurs in individuals that have a poor immunity. It presents with multiple macules, papules, plaques, and nodules of different sizes and shapes. Remember that macules are skin patches that have a skin color that is different from that of the surrounding skin, and they are usually not elevated above the skin surrounding them. They are on the same level with the skin surrounding them, the normal skin surrounding them. The macules of the borderline lepromatous leprosy are usually erythematous, that is, they are usually red in color. Papules are usually small, solid, raised swellings on the skin and they are usually less than 1 centimeter in diameter. A plaque is a raised skin patch and it is usually more than 1 centimeter in diameter, but its surface is usually flat. While a nodule is a small, solid, firm swelling that develops under the skin and it is usually more than 1 centimeter in diameter. The macules, the papules, the plaques, and the nodules usually occur on both sides of the body. They are symmetrically distributed. The difference between the borderline lepromatous leprosy and the lepromatous leprosy is about the intensity and degree of infiltration of the skin by the cells of the immune system and the Mycobacterium leprae. In the lepromatous leprosy, the degree of infiltration is higher in comparison to the borderline lepromatous leprosy. The borderline lepromatous leprosy can downgrade to the lepromatous leprosy, which is actually more severe, more intense. That is why when you see any of these lesions that I've laid out for you, the macules, the papules, the plaques, the nodules on your skin, you should come to the hospital such that we can make a diagnosis and treatment can be instituted on time. The lesions of the borderline lepromatous leprosy usually contain a lot of the Mycobacterium leprae, that is between 4 to 5. And this is because it occurs in individuals that have a poor immunity, so the immune system was not so competent to eliminate the Mycobacterium leprae. That is why they are more in number. There is also associated involvement of the peripheral nerves. but this usually affects one side of the body. The macules, the papules, the plaques, and the nodules of the borderline lepromatous leprosy usually have normal skin sensation. That is, when you touch that area, you can feel that you have been touched. Or when you prick that area, you can feel pain. The intervening skin, that is the skin between the lesions, is usually normal. If you see any of these lesions that I've detailed from the beginning of this video, there is a possibility that you have leprosy. So it is very important that you show up to the hospital such that diagnosis can be made and treatment can be started. And for the health workers, please make sure that you don't miss out this diagnosis. There are some patients who can still present with these skin lesions, and it is very important that you don't miss them out or you don't misdiagnose them. That is what I had for you. Thank you so much for watching and listening. Please share my videos and also subscribe. See you in my next video. Bye.